see.
Kunyot, do you know how many are accessed here in Thailand in universal healthcare coverage?
Very low.
Zero.
Wow. What are the key factors to win the fight against cancer in the future?
How the government goes about trying to finance the investment.
World Cancer Day, or WCD, is a platform led by the Union for International Cancer Control. Today we have special guest Kun Farid Bidgoli, General Manager of Roche Thailand, Myanmar, Cambodia and Laos. He will talk about the cancer and the well-being of Thai people.
Thanks for joining us today ครับ สวัสดีครับ
Sawadee krap, Kunyot. Thank you very much, and thank you for the nation for welcoming me on today.
What does the campaign with the hashtag Close the Care Gap mean to you personally and professionally?
Yeah, thanks, Kunyot, for the question. And this year, I really must say that I love the campaign of closing the care gap. And for me, it means a lot. I unfortunately have lost two grandparents to lung cancer during the course of my life. And one grandparent also had breast cancer. And you know, if I think about the medical advances and technologies today, if they were accessible even 7 years ago, back in the UK, then I'd have been able to close the gap. I'd have been able to spend more time with my grandmother. So I think from a personal perspective, you know, I've seen firsthand how cancer can impact the lives of individuals and that of the family. And when we talk about closing the care gap as well, one of the things I'm really passionate about is closing the care gap between those countries that have really great access to diagnostics and therapeutics and good infrastructure, and countries like Thailand, low middle income countries, who are still evolving, who still need greater access to advanced diagnostics and great therapeutics, great medicines. So professionally for me then, you know, I'm really passionate about closing that gap here in Thailand, making sure that Roche, together with all my fantastic employees, can really make sure that we raise awareness as we're doing today. We partner with the NCI, we partner with Chulalongkorn Royal Academy, or maybe it's the Thai Breast Society, or maybe it's the Thai Cancer Society, to really raise awareness and really lobby around wanting change to improve outcomes for people here in Thailand.
What do you think are the unmet medical needs for cancer patients in Thailand?
Yeah, for me, there are kind of two main things. I think firstly, treatment. And, you know, it probably is easy for me, right? As, you know, GM of pharmaceuticals say we don't have access to good medicines, but actually the facts are there. So in 2019, Chulalongkorn Royal Academy actually published a clinical paper that anybody can go and see that assessed the access to medicines in Thailand, cancer medicines in Thailand, compared to those medicines that were recommended by the international National Clinical Network guidelines. Now, these guidelines are the one that all of the physicians in Thailand follow. And there were some horrifying facts. So out of all cancer medicines available, only 6% of those medicines that are recommended in those guidelines are available here in Thailand under universal healthcare coverage. And it gets worse. So when we look at the burden of disease in Thailand, and we look at, for example, liver cancer, lung cancer, and breast cancer. Now, these are the most prevalent cancers in Thailand. Then if we take something like liver cancer is the #1 cause of death. This kills 3 people every hour in Thailand. Yeah, 27,000 people a year. Imagine. In the National Clinical Network guidelines, there are 7 medicines that are recommended.
I see.
Kunyot, do you know how many are accessed here in Thailand in universal healthcare coverage?
It's very low.
Zero.
Wow.
If we look at lung cancer, in lung cancer, then there's a recommended 15 medicines. Yeah, in Thailand, access 1.
Wow.
In breast cancer, 21 recommended medicines. In Thailand, in universal healthcare coverage, the public can access 2.
Mm.
So there's a huge gap. So when we talk about closing the gap, there's
Mhm.
this huge gap to close in terms of access to treatment. So it's a huge unmet need if we're going to really improve the outcomes for patients here in Thailand.
Mhm.
The second unmet need is diagnosis and early diagnosis.
Mhm.
And 10 years ago, 2012, actually, researchers, scientists, we used to think that cancer was the disease of the cell.
Mhm.
Today, we know cancer is the disease of the gene. Yeah.
Right. Mhm.
And therefore, when we look at diagnostics today, we need what we call molecular diagnostics, comprehensive genomic diagnostics.
Mhm.
And the reason for that is that we need to understand what is the genomic mutation so we can choose the right medicine and the right therapy for patients here in Thailand and across the world. And what we know now is it's not just about making sure that we get the right diagnosis, right, by understanding what the genetic mutation is so we can make sure we give the best medicine for that genetic mutation. Today, what we're seeing in research is that the earlier we diagnose cancer, the bigger the benefits in overall survival. And just to put this in context for you, a study that we did in non-small cell lung cancer, which is a type of lung cancer, then what we did is that versus the standard of care versus chemotherapy, our medicine was able to demonstrate survival of around about 9 months. Yeah. Now, that doesn't sound that great, right? Is that the best we can do?
Right.
Just 9 months of extra survival. Now, what we did is we add then what we call a molecular test in there. Yeah. And when we have the molecular test and we understand what patients have, let's say, the right mutation, then actually when we give the medicine to those patients with the right mutation, we extend that to 21 months. Right? So now that's a little bit better.
I see.
But today, and we bring this medicine to patients here in Thailand for lung cancer. Today, research very recently published shows that when we diagnose patients really early, what we call stage 2 lung cancer, when we give it them in combination with surgery, we've diagnosed them early, then what we know is that actually patients are surviving for 3.5 years onwards, and we're still looking at survival. So early diagnosis is really, really, really important. So if we get the early diagnosis right, and then we get the right testing and treatment right and access to that, then actually we start getting closer to a cure in cancer, which is really exciting.
What is it critical to take action and close the gap?
Yeah. So Thailand, I guess there's two reasons, right? And there's one why we should close the gap for obviously for people in Thailand, for patients, and then there's another that actually we could close the gap for government. So let's talk about people. So cancer is the #1 cause of death. Yeah. So more people die from cancer than they do from heart disease, from road traffic accidents. And when we start looking at that, around about 190,000 people will die every year from cancer. 190,000. Now, if we compare that to COVID, 22,000 people have died from COVID in 2 years. Yeah. And when we look at the interventions that we put in place to prevent deaths with COVID and ill health, 22,000 deaths versus 190,000 deaths a year. And when we look at the burden of disease, then liver cancer, lung cancer, breast cancer are the most prevalent cancers. And the fact that liver cancer is killing 3 people every hour, lung cancer is killing over 2 people every hour. Yeah. Then we need to do something about this. And that's why from a people perspective, we need to make sure that patients can access the treatments that can help them survive longer. From a government perspective, the reason the government should want to close the gap is quite simple. Thailand is an aging population. And with an aging population, the incidence of cancer will increase. It undoubtedly will increase. And if Thailand wants to have its workforce, its population productive, contributing to the economy, it needs to keep its people healthier for much, much longer. And cancer today, as I've just described, it's not a death sentence. We diagnose it earlier, we treat it the right way, we can have huge impact on patient lives and patient outcomes. And those people continue working, they continue contributing to the economy, and they can have great quality of life. A study done in 2016 by Deloitte showed that the government actually, because of premature death, because of cancer, actually loses around about 0.4% of its GDP every year. Now, if you were to ask the Minister of Finance, can I increase your GDP by 0.4%? He would say, please, COVID, I'd love you to do that. Right. Well, actually, if you were just to invest in appropriate diagnosis and advanced treatments for cancer for your population, you can avoid those premature deaths.
In your view, what are the key factors to win the fight against cancer in the future?
Yeah, so obviously I mentioned early diagnosis and I mentioned access to treatment. I think that the third thing really would be how the government goes about trying to finance the investment. And what we see that the investment of GDP in healthcare in Thailand flat, and it's been flat for the past 10 years. So how would you then have better outcomes in cancer without investing? Well, it's impossible. You need to invest. But there are different ways that we can look at that. And what we're trying to do is today, the traditional method of appraising medicines, whether they are cost effective for Thailand, and we do a health technology appraisal. Unfortunately, that is not sufficient for cancer medicine. It's not a sufficient process for cancer medicine. So we need alternative approaches. Some approaches could be, how do we use, for example, sin taxes from alcohol, taxes from tobacco, which actually cause cancer. How do we use those taxes, invest those into a healthcare budget that supports cancer? That's possibly one way. The other way is how does the government work in partnership with manufacturers like Roche and other pharmaceutical companies to make sure that patients in Thailand can access medicines? And there are many different ways that we work with governments all around the world. So with some governments around the world, for example, if I look at Korea, we have what we call an outcomes agreement in Korea. So actually we say our medicines achieve this in our clinical trials, and therefore you should expect those same outcomes. So if we achieve those outcomes, then please pay us the price that we requested. However, if we don't achieve those outcomes, you don't have to pay us as much. And that's called outcomes-based pricing. So that's one way. The other way is volume-based. So obviously, the more that the government's willing to spend on medicines, then obviously the cheaper they should be. And those are other approaches that we can take. And then also things like capping. So for example, we know that, today the average number of patients diagnosed every year with liver cancer is around about 27,000 people here in Thailand. Now, we therefore know how many of them potentially need treatment as well. So we can start working out these budgets, and therefore we can say, okay, well, we'll create a cap. If your budget is, I don't know, let's say, for example, 50 billion Thai baht to treat this cancer, then, okay, if we go over that, then Roche or another pharmaceutical company takes some risks. However, if you go under that treatment threshold, then you take the risk. So there are different ways from an alternative financing that actually the government can procure and work with manufacturers, as well as different ways that actually it can get funding as well from its medicines through its taxation system and through its policies as well.
What would you say to the public on World Cancer Day?
So I think, what would I say to the public? What would I say to my friends, right, about cancer? I would say, first and foremost, don't be scared of cancer. 1 in 2 of us, will get cancer during our lifetime. So, Kunyod, you or I may get cancer. Now, what's important is how early that cancer is diagnosed. That's what determines the outcome. That and access to great diagnosis and therapeutics, but diagnosing early is key. And that's it. That's the same with every disease. So what I would say is make sure that if you're a woman, go for regular breast examinations. If you feel a lump, don't stay with it. Go and have it checked out. You know, if you're eligible for the hepatitis vaccine, B vaccine, that helps prevent liver cancer, go and get the vaccine. If you are a young girl, go and get the HPV vaccine to stop having the risk of cervical cancer. These are some of the things that we should be doing, and we need to understand that actually it's not just around understanding the signs and the symptoms, but actually around our lifestyle. Yes, don't have a sedentary lifestyle. Make sure you're eating well, fresh, nutritious foods. Stop smoking.
Right.
Yeah, don't smoke. Yeah, reduce alcohol intake. Yeah,
right.
in Khon Kaen, in the northeast, in the entire world, Khon Kaen is the #1 place in the world for the highest incidence of liver cancer.
Wow.
Why? Because the people in the northeast like eating raw fish, and in the raw fish there's a parasite, and that causes liver cancer. So it's very simple. We have to take ownership of our own health and our own decisions to reduce our risk of cancer. After that, what I would say is make sure you're accessing the technologies and the treatments that you need and getting diagnosed really, really early. And then understand what your benefits are. What are your benefits under universal healthcare coverage? What are they if you're insured under the Civil Service Medicine Benefit Scheme? And those interventions will help you close the gap.
On occasion of World Cancer Day, how Roche has contributed to the transformation of the lives of people with cancer.
Yeah, thanks, Kunyard, for asking that question. We invest 12 billion euros in research and development every single year. We invest more research than any other pharmaceutical company in the world. In fact, we're in the top 10 of all companies in terms of driving research to improve health. And the majority of that research is in cancer. And actually that gets translated to Thailand. So actually Roche here in Thailand, we've been here 50 years. And we invest more in clinical trials than any other pharmaceutical company. In fact, today I can tell you that we have 32 clinical trials in oncology in 117 different hospitals.
Wow.
And currently today, approximately 530 patients are getting treated with the most advanced therapies, not yet even licensed in the rest of the world, to help treat cancer. So we significantly invest in research and development as well. From a medicine side, then quite interestingly, since about 2018, we've helped treat over 10,000 women with breast cancer with one of our medicines. And today what we see is that breast cancer has dropped out of the top 3 most common causes of death. Yeah, and it dropped out of the most common causes of death from the top 3 because of the access to one of our targeted therapies, which is phenomenal. Which goes to show when the government does invest in the right medicine, it has an impact. And then I think in addition to what we can see is how our employees are passionate about really bringing change, and therefore working with the stakeholders, the doctors, around helping educate them on the new diagnostics and new therapeutics, advances in therapy, and then bringing together stakeholders, acting as a catalyst and a convener to bring people together, like the NCI, Chulapur Royal Academy, NHSO, Thai Cancer Society, bringing them together to discuss this important issues of how we close the gap.
That's all. We learned a lot about key issues on the World Cancer Day 2022 and how preventive measures by Roche. Thanks Mr. Farid Bidgoli, General Manager of Roche Thailand, Myanmar, Cambodia and Laos. Thanks for joining us today.